Yeah, today we are going to discuss about benzyl penicillin. So, initially we'll know about the classification of beta-lactam antibiotics. See, beta-lactam antibiotics. Yeah, and I will make this classification very simple. Just pay attention to the class and write along with me. Okay. First we have first initial code to know about the subclasses. PM Sir Ka cephalosporin car. Yeah, so I will tell the abbreviations also. This is penicillin, this is monobactam, this is cephalosporin itself, and car for carbapenem. See, in the beta-lactam antibiotics, we have penicillins, monobactam, cephalosporins, and carbapenems. So we are remembering them with the code PM circa cephalosporin car. Yeah, and we are writing the abbreviations. Okay, and now we'll know all the drugs which are there in this classification in a very easy manner. Yeah, initially we know penicillins. We have penicillin G. I am writing PNG. It is penicillin G. You should not write like that in exam. Yeah. Initially we have penicillin G, but it is not resistant to acid. It is acid labile. It will be destroyed in the acid. So first, in the first classification, we can write acid resistant and alternative to what? Alternative to penicillin G, because it is not acid resistant. So acid resistant and alternative to penicillin G. Write penicillin G, don't write like PNG. Okay, acid resistant alternative to penicillin G. What is that? Penicillin V and phenoxymethyl penicillin. Is it right? Penicillin V we can write, and phenoxymethyl penicillin. Okay, if you remember, you can write. So we can remember this for sure. Acid resistant alternative to penicillin G. And by bacteria an enzyme is produced, that is penicillinase, which degrades this beta-lactam ring of these penicillins. So we have to make drugs which are resistant to penicillinase also. So in the second subtype we can write penicillinase resistant. Yeah, in the penicillinase resistant, write cillin and cillin. Yeah, this is cloxacillin, and again write cloxacillin. Yeah, cloxacillin we are writing and add di. Yeah, this is cloxacillin, this is dicloxacillin, and one more is for methicillin. Yeah, this is methicillin. 3 drugs: cloxacillin, dicloxacillin, and methicillin. Okay, is it right till here? Okay, and now we should also have, these are for limited spectrum, so we should have an extended spectrum of penicillin. So extended spectrum penicillins. The most favorite drug of us, we will write for most of the answers in microbiology, that is amoxicillin, right? So amoxicillin comes under aminopenicillins. In the aminopenicillins we have what? Amoxicillin. So if you write amoxicillin, you can also write ampicillin, right? Yeah, ampicillin. Okay, after writing ampicillin, again read this ampicillin and add back ampicillin, amoxicillin, ampicillin. Is it right? Okay, Next we will go with carboxypenicillins. In the carboxypenicillins we have, okay, here from this name only you can remember that car is there, right? Car is there, cillin is it. So write car, cillin, and in the second also write car, cillin. First it is ticarcillin and this is carbenicillin. See, we have what this is making, it's making benedicts. So sorry, this is ti, right? So beneti, we can remember like that, but most of the spelling in our drugs we are getting initially, right? So car we got, cillin we got, car we got, cillin we got, and in the first drug we have to add something in the middle, and in the second drug we should add something in the initial things. And ticarcillin I think we can remember. So carbenicillin, we might write carbenicillin like that, but if you practice 2-3 times you can write carbenicillin, right? Okay, and one more there is, that is uridopenicillins. Uridopenicillins. Here we have there is opera house, right? Opera house somewhere, I don't know where it is, but piperacillin. It's not operacillin, but it is piperacillin. Yeah, and if you remember you can write this, but if you also remember you can also write meslocillin. Okay, in the uridopenicillins we have piperacillin and meslocillin. Okay, nice. We had completed with the penicillins, and now we'll go with cephalosporins. Okay, in the cephalosporins just follow the code, write 1 2 3 4 and 5. Okay, and write ceph and ceph. Okay, nice. In the first row also write this cepha. This ceph is where, this ceph is where, CEPH, that is, this is CEF. Okay, good. Okay, in the first write olin, and in the last write oline. Don't forget to write the C. Okay, oline. Okay, then write IME and 1. Okay, then this is first, and in the second again write ceph, and in the also third write ceph. Okay, till now it's good. So in the alphabets, first is what is the first letter? A, right? And what is the last letter? Z, right here. Okay, then ceph. Now one more code, Alex, your tri-epic target is pharma, this one, pharma class topper. What I had written, Alex, your, this is WhatsApp language, your, right? Your, we write Vivo your, but in WhatsApp we write your. Yeah, Alex, your tri-epic target is pharma class topper. Yeah, I am taking pharma from PH of cephalex. Okay, and okay, till now we had completed. So shall we check, did we get any drugs? Yeah, cefazolin, we got one drug from the first generation, and ceftarolin, we got first drug from the 5th generation, 2 drugs we got, and cefepime, we got one drug from 4th generation, and ceftrione. So cephurime, this is not cephurime, it's cefuroxime. It is cefuroxime, and this is not ceftrione, it is ceftrioxone. ceftriaxone, and cefuroxime. And so if we remember in this way, we'll get most of the spelling, and we can fill that 2 or 1 word in it, and we can complete the classification. Yeah. So, and this is cephalexin, and this is cefaclor, and in the initially what we had written AZ, right, from the alphabets. So write AZ, ceftazidime. I think we can also write IME here, as we written here IME. We can also write IME here, and we can continue it. So till now we completed ceftazidime, cefaclor, cephalexin, cefazolin, cefuroxime, ceftriaxone, cefepime, ceftaroline, and in the third generation we have some more drugs. This one also with code cef, and cef. Yeah. In the ending write IME. Okay. Then taxi podosites. No. It's okay. Cephime we had written, and taxi podo. Okay. Here cefotaxime, cefixime. Okay, not 2 I's here. Cefixime, cefpodoxime. Okay, cefotaxime, cefixime, cefpodoxime. We had how many drugs we got from the third generation? Ceftriaxone, ceftazidime, cefotaxime, cefixime, cefpodoxime. Yeah. Yes, we had completed the cephalosporin classification. I think if you practice once or twice, you will remember almost all the drugs. So just write with me in the video itself. You can remember by the end of this video. Okay, now we had completed penicillins and cephalosporins. Again we'll go with carbapenems. In the carbapenems, write penem, and penem. Okay, we had written. So if you have a doubt, you will DM me, right? You will DM me in the Instagram or YouTube something. Okay, so that is the thing I'm going to use here. That is how what is the meaning of this? That is, right? I.E. means that is. So that is DM me 2. That is DM me 2. And remember, don't write this randomly, because if you write randomly the code might be lost. So METO, me 2. Okay, this is impenem, etpenem, dopenem, mepenem. So this is meropenem, doripenem, etrapenem, imipenem. Okay, these are the carbapenems: imipenem, etrapenem, doripenem, meropenem. Okay, and in the carbapenems we had monobactams. We have Astrionam we have, only single drug we have, Astrionam. And for this code is this. And we'll be discussing about the mechanism of action of benzyl penicillin or penicillin G. Yeah, mechanism of action. So yeah, suppose see, there is a structure like this. It is not being connected between these two. There is no connection between these two. And there is one more structure, we have connection between these two. Okay, if you try to pull them apart, which will have more strength? Obviously this, because it has cross linkages between. Okay, the same works with the bacterial cell wall. So see, in the bacterial cell wall we have sequences like NAM, NAG, NAM, NAG, and one more NAM, NAG, NAM, NAG. Yeah, We have NAM, NAG, NAM, NAG, NAM, NAG. Okay, what are this NAM, NAG, NAM, NAG? These are just sequences through which the bacterial cell wall is made up of. Okay, what is this NAM? N-acetyl muramic acid, N-acetyl glucosamine, N-acetyl muramic acid, N-acetyl glucosamine. M for muramic acid, G for glucosamine. Yeah. Okay. Then we are discussing about cross linkages, right? Means to increase the strength of the bacterial cell wall, the bacteria forms the cross linkages. How it forms the cross linkages? Yeah. For this NAM attached, there is L-alanine sequence, D-glutamic acid, L-lysine, and D-alanine. You don't need to remember this sequence. For just concept purpose I'm telling it. So for this, okay, initially we have NAM, NAG, NAM, NAG, NAM, NAG, NAM, NAG, two chains which are parallel to each other, and they are not linked apart. Okay, if during cell division they are cross linked to increase the strength of the bacterial cell wall. Okay, till now we understood. Okay, then how that cross linkages are made? Yeah, that is the thing. L-alanine, D-glutamic acid, L-lysine, D-alanine sequence is attached to the NAM, that is N-acetyl muramic acid. Okay, the sequence is contained by the NAM. Okay, an enzyme known as transpeptidase. What this do? It will detect the D-alanine sequence, and it will break one of the D-alanine which is terminal. Okay, it will only delete the D-alanine which is terminal. That means what happened here? The terminal D-alanine is lost. Okay, and we are left with one D-alanine here. Okay, now this D-alanine, see here, one D-alanine is broken, right? So we have energy produced. We have energy released energy. So this energy released is used to link with this, means the same through D, it will be linking like this. Means the same process, transpeptidase come, delete the last terminal D-alanine sequence, and the linkages will be done like this. So the strength of the bacterial cell wall will be increased. Yeah, good, right? Okay, it's finished. Okay, now do we want to increase the strength of the bacterial cell wall? No, we want to decrease it, right? So what we do, we use penicillins. How these penicillins are working, we'll see. So here initially we have D-alanine sequence, right? Okay, before formation of the cross linkages, thus D-alanine sequence is resembled by penicillins. That means penicillins act like D-alanine sequence. They show in their properties, they show D-alanine sequence, which is recognized by this transpeptidase. Okay, instead of recognizing the bacterial D-alanine sequence, it will recognize the D-alanine sequence of the penicillin. Okay, after this D-alanine sequence of penicillin is recognized by the transpeptidase, it will stop the transpeptidase. That is the thing. So if the transpeptidase is stopped, there is no cleavage of D-alanine sequence in the bacteria, and there is no cross linkages formation, and inside there will be autolysins which will be increased, and what happened, there will be increase in osmotic pressure, and there will be bacterial burst, and the cell will eventually die. Okay, I think it is very clear. Let me tell some briefly. So we have D-alanine sequence, right? So this D-alanine sequence is transpeptidase, is recognized by transpeptidase, which then leads to the formation of cross linkages. But our penicillin also mimics this D-alanine sequence. By mimicking the D-alanine sequence, it will bind with the transpeptidase, and this transpeptidase is inhibited, so there will not be formation of cross linkages. So the bacteria will, inside the bacteria, the osmotic pressure will be increased, and eventually it leads to burst and the cell will die. Yeah, Now we'll discuss about the therapeutic uses. In the therapeutic uses, right, benzyl G, benzyl penicillin G, okay. So B for bacillus anthrax, and E for endocarditis, and that is in specifically subacute bacterial endocarditis during dental extraction or endoscopy. Yeah, we finished E. And N for Neisseria meningitis, that is meningococcal meningitis. Yeah, then Z for zoonotic infections like Listeria monocytogenes and also riot bite fever. Then what we finished? Z we finished, right? Yeah. Y for yaw or spirochete disease, that is Treponema pallidum. What it causes? Syphilis, right? So for syphilis, it is drug of choice. Okay. What we finished? L. L for lockjaw. Where we can see lockjaw? We can see lockjaw in tetanus, right? So in tetanus actually we use antitoxin. So this penicillin G is used as an adjunct drug or add-on drug with antitoxin. Okay. And G for gas gangrene. Okay. What we are doing, we had taken benzyl G from the question itself and we are writing from the letters of it only. Okay. B for bacillus anthrax, E for endocarditis, subacute bacterial endocarditis during dental extraction or endoscopy, and N for Neisseria meningitis or meningococcal meningitis, Z for zoonotic infection like Listeria monocytogenes and riot bite fever. Y for yaw, this is a disease caused by the spirochete. You can check out, you can type this name in the Google and you can get the photo. And syphilis, for syphilis is drug of choice. And L for lockjaw in tetanus as an adjunct drug with the antitoxin. Antitoxin is given for tetanus. So we can use this benzyl G for remove the organisms which are left over, and G for gas gangrene. Apart from this, we have two other uses. Apart from this, we have two other uses like in diphtheria. We can use it in diphtheria to remove carrier state. And one more, this is benzathine penicillin G. It is not benzyl penicillin, it is benzathine penicillin G. Okay, in this benzathine penicillin G we can use for rheumatic fever prophylaxis. We can use it for rheumatic fever prophylaxis. How it removes hemolytic streptococci. Yeah, it prevents hemolytic streptococci from colonization. It can be given in IM route per 3 to 4 weeks, one dose for 3 to 4 weeks, and till how many years? Till 18 years or 5 years after attack. Sorry, till 5 years after attack. Yeah, after attack. Till 5 years. No, I think sentence is wrong. Till 5 years after attack. Yeah. We can give benzathine penicillin G in rheumatic fever prophylaxis, which stops the colonization of hemolytic streptococci. And in IM route we have to give, that is 3 to 4 weeks till 18 years or till 5 years after the attack had been occurred. And these are the therapeutic uses. Now we'll discuss about the adverse drug reactions, contraindications and drug interactions. Yeah, for this write pen G, adverse drug reactions. P for pain or prolonged hypersensitivity. Hypersensitivity is the main or adverse drug reaction of the penicillins. So this hypersensitivity may range from, it might be rash, it might be serum sickness, okay, it might also be anaphylaxis. Okay, it might also be anaphylaxis, it might be rash, it might be serum sickness, it might be anything. Okay, if it is given at IM, at the IM side there may be pain or abscesses. Okay, sterile abscesses. At the IM side there may be pain and sterile abscesses. And if it is given IV, thrombophlebitis may happen. Then E for exacerbation of swells, also called Jarisch-Herxheimer. Jarisch-Herxheimer reaction. What happens? Exacerbation of syphilis. Due to rapid killing of Troponema pallidum spirochetes, there will be release of the spirochete granules. So there might be a fever, myalgia. So this might be there. So it is called exacerbation of syphilis or Jarisch-Herxheimer reaction. It is an adverse drug reaction of penicillin G. So if it happens, should we stop penicillin G giving penicillin G? No, we should not stop. We can continue it, but we have to give aspirin and sedatives. Okay, we are not needed to stop the penicillin G, but we can give aspirin and sedatives. Okay, and for neurotoxicity. Okay, and for neurotoxicity, in the neurotoxicity they might get, okay, why neurotoxicity happens? If the patient is renal insufficient, because the excretion will be taken out by kidneys, right? So if the patient is renal insufficient, the penicillin G amount in the blood will be increased and there might be convulsions. Okay, convulsions and tremors we can see, and what muscle twitches we can see. And if in high doses also we can see, in renal insufficiency also we can see, what we can see? Convulsions, muscle twitches we can see. Okay, and in contraindications, in allergic patient we should not give. In renal insufficiency and in allergic patient we should not give, in renal insufficiency we should not give, and one more thing, we should not give intrathecal injection, because what more adverse drug reactions will be there. We should not never give intrathecal injection of this penicillin G. And topical application of penicillin G also is contraindicated, because might lead to sensitization. Okay, this one is finished. Okay, what are the drug reactions? Probenecid, which is a uricosuric which is used in gout. If you give with penicillin G, what happen? This probenecid competes with the penicillin G to be excreted by the tubular cells. So the excretion of penicillin G will be decreased. So the quantity of penicillin G in the blood will be increased, and it might lead to severe toxic effects. And if you give it with bacteriostatic, okay, but not bactericidal, if you give it with bacteriostatic like that, see, if you give with bacteriostatic drugs like tetracyclines, what it might lead to? Actually, our penicillin acts against actively dividing bacteria, but what we are making them bacteriostatic, right? If you give it bacteriostatic drugs, the penicillin might not have any effect. It might be ineffective if you give along with tetracyclines. Yeah, these are the contraindications and drug interactions. Yeah. Now we'll discuss about formulations. This will be more mark fetching. You can write it. It will be very easy. Don't think it will be hard. See, first make boxes like this. In the first you write sodium penicillin. This is the crystalline form, and procaine penicillin and benzathine penicillin G. Okay, sodium penicillin we can give IM or IV. This is IM. Then in the procaine penicillin we have procaine plus this one extremely slow repository. Okay, extremely slow releasing repository suspension. Okay, and this sodium penicillin, it is rapidly excreted by kidneys, and we need frequent dosing, that is 6 to 12 hours. And this procaine and this soluble penicillin here, soluble penicillin initially raise the level and it will maintain the level for some longer duration. And this extremely slow, we can give it for only single dose for 2 to 4 weeks. That is why we are using in rheumatic fever prophylaxis. Okay, these are the some of important preparations, that is procaine penicillin, sodium penicillin, benzathine penicillin G. Okay, these are all the important things. I hope you understood. Thank you.